Many of us experience pain, from headaches, neck and back aches, to muscle spasms. They come in many forms, and they can be uncomfortable, unpleasant, or even annoying. For some, they can also be debilitating. Today on the program, we'll try to understand pain and the ways in which we can manage it, and in particular, natural pain relief alternatives. I'm Dr. Freddie Gomez. Pain is a vital alarm system that helps us recognize that there's something wrong in our body. And joining us today are Dr. Fatima Lautan. She's a traditional Chinese medicine practitioner from the Medical City. And we also have Dr. Franklin Domingo. He's a physical medicine and rehabilitation specialist from the Makati Medical Center. Welcome to the show, doctors.
Thank you. It's a pleasure to be here.
We're glad to have you. And today's topic, we'll be talking about pain and many ways on how to manage pain that can be very debilitating for some people. But before we go into the ways in which we manage pain, let's first talk about what pain actually is. Like, what actually is pain and why does it happen?
Pain, of course, is something which we all know that because we experience it, but it's
Right.
kind of hard to put a finger on it. And I would describe it as something which is an emotional and sensory experience that is unpleasant, that may be related to something which is potentially or actually harming us.
Okay, now doctor, what are some of the common triggers naman for pain?
There are a lot of triggers for pain. One is stress, inflammatory foods like sugar and caffeine, also bad sleeping habits, bad posture all contributes to pain.
Can we categorize pain being the same all throughout?
There are two kinds of pain, mostly nociceptive, which affects our organ systems or vital tissues in our body, or it could be neuropathic pain, which affects the nerves that we have.
Which is more uncomfortable to the person when it comes to pain?
Neuropathic pain is the challenging type of pain to treat. People may have neuropathic pain, and it may affect the way they sleep, the way they work, and it comes at a cost.
Okay.
Instead of being able to do things more efficiently and effectively, they lose out on a lot of opportunities.
Now, Doctora, pain doesn't feel the same as Doctor mentioned earlier. It may not feel the same for everyone. Someone might feel pain that is tolerable. Another person may feel that that's the worst pain they've ever felt. How would you classify these types of pain?
There are two types of pain. We have the acute pain and chronic pain. So for acute pain, this lasts for less than 3 months. So this is due to activation of the alpha A, delta, and C fibers. They are activated in response to tissue injury. There are 3 types of acute pain, like somatic pain. These are superficial pain that arises from the skin, visceral pain that originates from the internal organs, and the referred pain, which is a pain felt away from the origin of the pain. And the next is the chronic pain, which lasts for more than 3 months. This is due to persistent activation of the A delta fibers and C fibers.
What is the relation of stress naman, doctor, with pain?
A good question. Stress can actually aggravate the pain. Lack of sleep can aggravate the pain. Lack of exercise also can contribute to the exacerbation of pain.
Okay, and do you think all of these can also affect the mood of a person? Because some people may seem a certain way, may seem grumpy all the time, may be
yes.
difficult to handle.
Right.
Could pain or chronic type of pain, which Doctora mentioned earlier, could this be part and parcel or one of the reasons why they are like this?
Yes, this is in fact one of the symptoms of neuropathic pain, where pain just keeps on sending signals through the nervous system, through our nerves, into the limbic system of our brain. The limbic system being the primitive part of our brain, which is responsible for sleep and, of course, our emotions. And that's why we get to be affected in our sleep and in the way we deal with people. We become more irritable. It's easy
Right.
for us to just become more emotional sometimes.
Now, Doctora, for those suffering from the chronic type of pain, are there some symptoms or telltale signs that may manifest, that may prompt the person or prompt the physician to think that they have chronic pain?
Aches and pain are common complaint in patients with increased level of stress, no? Because stress tightens muscles, especially on the key areas around the muscles around the neck and the shoulders. So this will affect the quality of life and decrease productivity.
Doctor mentioned decreased quality of life, productivity. Is this something that someone should be concerned about? Because a lot of Filipinos, a lot of people for that matter, feel something, kaya ko naman to eh, hindi ko na lang papatingin ko, sanay na ako sa ganitong klaseng pain. Is pain something that should be endured?
It's something which we should be free of, definitely. We should be liberated from pain. It's not something we have to experience, and it is probably a symptom of something deeper underneath. So it's very important for you, if you have pain that's really bad, to see a doctor so that we can go to the root cause of it all. And we can treat the pain at its root and make sure that that pain is very much addressed.
What if usual pain relievers do not work on relieving the kind of pain you have? What are your options? Keep it here on Med Talk Health Talk, only on CNN Philippines. Welcome back to the program. You're watching Med Talk Health Talk on CNN Philippines. Pain is subjective. One person's level of pain may or may not be the same with another. But what they have in common is that it interferes with their quality of life. Can you skip the traditional pain medication and start with alternative treatment right away? Still with us is Dr. Fatima Lautan from the Medical City and Dr. Franklin Domingo from Makati Medical Center. Now, Doctor, going on with the conversation, we talked about what pain is and the different levels of pain before the break. But now, why is it that one person's pain is different from another? Why is the interpretation of pain different from one person to another?
Good question. It might be because what that person is experiencing is subjective and that's truly unique to his self. It may be possible that what one person is experiencing is different from another person because the pathology might be different. So the causes of the pain generators might be different.
Okay, but for something like this, would the treatment be the same for both patients?
It may depend on what the true pain generator is.
And we also have what's called a pain management plan. Doctora, what exactly is this and how is it helpful?
There are many options for pain management, and one is taking pain medications, like analgesics, but not all individuals are willing to take pain medicines.
Right.
Or some patients have different medical conditions like liver or kidney insufficiency that cannot take medicine.
That may interfere with taking more medications,
Yes,
will
it
just
can
exacerbate or
worsen.
may
Yes.
worsen their present condition.
So they maybe can consider alternative medicine. One is acupuncture.
Okay, so do you think that alternative medicine, like when you mentioned acupuncture, is this something that you give a patient when traditional medicine or traditional medication no longer is effective?
Yes, this is a very, very good option for these patients.
Okay, now acupuncture comes or is under the realm of alternative medicine. Could you explain to us, Dr. Domingo, what is alternative medicine?
Alternative medicine is a practice of medicine which is separate from mainstream medicine.
Okay.
But when we do techniques such as acupuncture in complementary with mainstream medicine, as in patients who have neck pain who are being treated with physical therapy and they come to me because they're still having their neck pain, we can also do acupuncture for them, and that would be a complementary form of treatment. And if you're
Okay.
doing it in an institution which has both these facilities, mainstream and complementary, it might be called an integrative medical practice.
What are the more common ways naman, Doctora, that complementary medicine is used on someone? What are the common practices? You mentioned acupuncture. What are other ways in which you are able to treat a patient?
We also do tuina. Tuina is a Chinese massage. Like for back pain, we can have maneuvers
Okay.
that promote blood flow to these areas to lessen the pain.
Okay.
Also, we have a moxibustion. We use also in Chinese medicine practice along with acupuncture. These things, when combined, all promote blood flow and circulation to these stress areas like with shoulder pain to relieve pain.
Okay. Now, how is this different, Doctora, from hilot?
Hilot is a Filipino term for
Right.
massage. So they use maneuvers. They
Right.
have their own maneuvers that is practiced, handed down their lolos, their lolas.
Right.
That is, this is totally different from acupuncture and tuina.
So it shouldn't be misconstrued or it shouldn't be misinterpreted as one or the other.
Yes, that is.
Okay, now doctor, with this type of complementary medicine, integrative medicine, what kind of success rate are we looking at here?
Most of the time, we have 80% of the time, our patients get good to excellent results.
That's pretty high, that's pretty good.
Yeah, depending on the pathologic condition, of course, important.
With this type of treatment with a very good success rate, very acceptable as well, what kind of long-term effect do patients see? I mean, is this something that they're able to find relief from their chronic pain, some discernible relief from chronic pain that they have?
As long as they are compliant with the treatment, the chances of improving are very, very good. By success, we mean a 50% reduction in the pain scores. That's, of course, the definition of the World Health Organization. So if we can just decrease chronic pain by 50%, that would be a good victory.
Now, with this, once their pain is reduced and everything, is there something for maintenance that may have? Do they switch back, or can they take traditional medicines for maintenance, or is the complementary or integrative medicine the maintenance for their pain as well?
I think we have to get back to the basics, and the basics being exercise, proper diet, and right sleep. So as long as we have the basics covered, we should not be seeing you for a long time.
Okay.
Yeah.
But for those, Doctora, who may be afraid to take, a lot of people may be afraid to take a pill, they're not comfortable with it for one reason or another, is it safe for them to seek the help of alternative medicine right away?
Well, actually, I studied in China. Acupuncture is used as preventive. With people coming in without any complaint, they just say that for preventive. In Philippines, I want this to be practiced, that people come in for preventive.
Even everyday things, doctor, they can seek. Someone is stressful at work, or
Right.
they have a lot of, they have a big exam that they need to study for. These types of therapy, these types of medication, complementary and integrative, will be able to
help.
give some improvement.
Yes.
Not only can they be preventive, they may actually be preemptive.
Now that we know that there are other options to address pain, what are some of the known and effective alternative treatments for pain? When MedTalk Health Talk returns, we'll discuss some of these. Stay tuned, only on CNN Philippines. You're watching MedTalk Health Talk, and I'm Dr. Freddie Gomez. Alternative medicine can be a godsend to those suffering from chronic and severe pain. And one of its functions is to help your body's natural healing process. So continuing on with this discussion, what is the most common procedure that you practice in your office, that you see patients yearn for?
So let me discuss on acupuncture.
Sure.
Acupuncture is a Chinese medicine, traditional Chinese medicine, or TCM. This is a medicine that is 3,000 more years older than the traditional Western medicine.
Okay.
So this works on inserting very tiny and sterile needles into our body, on specific parts on our skin.
And these are special needles. These aren't just like ordinary
Yes, they are
needles.
sterile needles, and we dispose them after use.
Okay.
No? So this works by invigorating or replenishing our natural energy, or what we call as the qi.
Okay.
Because in Chinese medicine, we believe that sickness or illnesses occur when there is blockages or imbalances in qi, or the natural energy.
Okay. Now, Dr. Domingo, you practice acupuncture as well. Is this also by far one of the more common procedures that you see in your clinic, in your practice?
Yes, a lot of patients see me for acupuncture treatments. And one of the other treatments that we also do are physical therapy procedures. Of course, we prescribe exercise, and we prescribe pain modalities through physical medicine. And I also practice regenerative medicine.
Is acupuncture okay to use or okay to do on a person for acute pain as well as chronic pain?
Yeah, it can be used both on acute and chronic cases. So this qi flows through our body we have called these channels or meridians.
Okay.
So this qi flows through meridians. Then we have acupuncture points. We target where is the imbalance. We got to have the right diagnosis. Where is the imbalance, then we target that point. We manipulate. We can reduce or to stimulate that point, whatever. Then that energy will balance on itself.
Now, a lot of people who have never tried acupuncture might think they already have pain in their body and you'll be putting a needle on them. Won't that be causing even more pain?
Despite the fact that acupuncture procedure involves insertion of needles,
Right.
but this procedure is relatively safe. It's
The needles aren't
very,
inserted deep. They're just on the
They're very,
surface.
very, very fine, and it's very gentle. The procedure is non-invasive.
Okay, so this procedure, in essence, is actually very relaxing for those who
Yes,
try it out.
exactly.
Okay. Now, Dr. Domingo, for regenerative medicine, who are the best candidates for this type of treatment?
The best candidates for regenerative medicine treatments are people who've tried all conservative means and yet are not good candidates for surgery. So people who have low back pain, who have tried physical therapy, medications, sometimes maybe even acupuncture, and yet do not want to be operated on their backs for whatever reason they may believe to be unnecessarily so or necessarily so.
Right.
They can come to me and we can offer them options. We can offer them relatively significant treatment options which may control their pain.
How about you, Doctora? Is acupuncture safe for both the management of pain in both children and adults? Because a lot of parents might not feel comfortable with giving traditional medications for their children.
Oh, yes, it is safe also for children. In fact, I have patients 5 years old for Bell's palsy, and it's very good. The effect is good. Like 10 years old for growth, the effect is seen by...
And seen right away. So with that, I'd like to thank Dr. Franklin Domingo from the Makati Medical Center and Dr. Fatima Lautan from the Medical City for sharing your expertise. I guess it is an eye-opener for them that they know where to go to when they want to learn about other ways to manage their pain. So always remember that experiencing pain affects the quality of life, and that's why managing it in a proper way by visiting your doctor should always be your priority. I'm Dr. Freddie Gomez, and I'll see you next week.